Good evening, class. Did you know that according to the Center for Disease Control and Prevention, the average life expectancy for Americans is 78.7 years? However, on the other hand, did you know that a study conducted by the American Heart Association, for someone who uses anabolic steroids, their life expectancy is only 40 years old? Some of these anabolic steroid users were Ali Cooney, who died at the age of 20, David Singh, who died at 27, Scott Klein was 30, Mike Mencier was 47, Dan Kuchan 48, and Don Rossi 55. Again, these are only a few of the many anabolic steroid users who passed away due to the use of anabolic steroids, but it just gives you a good idea of the age range and how early in life someone can die from using anabolic steroids. The scary thing is about anabolic steroids is that not only adults use it. Kids as young as 8th grade can even get them. A study conducted by the National Institute of Drug Abuse, they reported that 1% of 8th graders, 1.4% of 10th graders, and 1.9% of 12th graders have used or are still using anabolic steroids. Due to people having such an easy access to this drug, it is possible that your child or niece or nephew or sibling of yours or some of your friends might be able to get a hold of it and try this drug, which would be very bad because this drug is terrible for you and it has many health problems associated with it that we will go over. To better understand this issue, I will go over a few of these different types of steroids and the risks that go along with them. Then we'll talk about what we can do to help deter any of those people mentioned before from even trying steroids even one time. Lastly, we'll go over what will happen if we succeed in stopping the use of this terrible life-threatening drug. First, let's look at the different types of steroids. In most things in life, there are some good things and some bad things. The same thing goes for steroids. The good steroids are used by doctors or are prescribed by doctors for certain diseases. But there are also bad steroids. In either case, steroids can be taken orally by inhaler and intranasal sprays, topical ointments, or by injection. Briefly about the good kinds of steroids, the Mayo Clinic organization said that one type of good steroid is corticosteroids. These steroids are used to treat rashes, lupus, or asthma, and again are given to you by a doctor, or the shot might be given to you by the doctor if it wasn't prescribed. In the Health Encyclopedia of the University of Rochester Medical Center, there are other good steroids that are made by your body, such as hormones, mineralocorticoids, bile salts or bile acids, and lastly sterols. These steroids are found to help male testosterone, female hormones, immune systems, balance of sodiums and potassiums, help digestion and absorption of fats, and build up cell walls. These are the good kind. Again, like I said, either your body makes them by themselves or a doctor will prescribe them to you for certain diseases or anything like that that you may get, like the rashes or lupus. Now, looking at the bad type of steroid, it is the anabolic steroid. This steroid is man-made and not made naturally by your body. The University of Rochester stated that the use of anabolic steroids can increase the risk for prostate cancer, stroke, and even heart attack. The National Institute on Drug Abuse wrote that the anabolic steroid use can lead to even brain damage, kidney failure, cardiovascular problems, and again they agreed that it can also cause heart attack and stroke. Steroid use can also give you severe acne, way worse than any kind of acne you might have thought you had when you were in your teens, going through puberty. And these are only a few of the side effects that a person can get from using steroids. And to help demonstrate what these look like, I got a few pictures to show you. In this first picture, you can see a male, and he was 20 years old when this picture on the above picture was taken, and you can see that he's very muscular. His body looks good, and this is why he was taking the anabolic steroids. However, it's not very easy to see that he had already started to develop severe acne. In the picture below, you can see that after he stopped the use of steroids, the side effect of severe acne kicked in, and that is what you see there on his chest. This here is a picture of a male chest, and this is what they call gynecomastia. This is the development of breasts. In this picture, you can see on the butt of this man, he has a little indent, and that was from repetitive shots injected into his butt of steroids. And this is a side effect that he got from that, over using the steroid injections. These are only a few pictures to help demonstrate what it would look like to have a side effect from it. But furthermore, other side effects for men would be shrinkage of testicles, reduced sperm count or infertility, baldness, and increased risk for prostate cancer. For women, a side effect is that they can grow facial hair. They as well might develop a male pattern balding. They have changes in their sensation of the menstrual cycle, enlargement of the clitoris, and even deepening of their voice. For adolescents, they may, if they use it, get their growth stunted due to the premature skeletal maturation. But now that we know what the steroids are and the different kinds that there are, how are we going to stop anyone from using the anabolic steroids that are so bad for you? Well, first off, we need to raise the penalty for everyone if they are caught using steroids, even one time. Currently, the penalty for the first time offense is possession is 1 year in prison and or a fine of $1,000. The prison time seems a little fair, but most people don't even serve that full time, so it doesn't really help. Also, for a professional athlete, they could care less about the $1,000 fine because they're making millions of dollars anyway, which I would say most people, even in like middle class, wouldn't really care of a fine as much as $1,000. So I suggest that this penalty gets raised to $10,000, and that way people will see the seriousness of this drug. Now, for a second offense, it is only a minimum of 15 days imprisonment. This is ridiculous to think about. 15 days is not enough time for someone to think about their actions and how they need to change. I think that the minimum should be raised to at least 90 days, if not more. But with that being said, we shouldn't just look at the legal aspect of how we can deter people from using this drug. We should also look at mentoring our friends or family or anyone else that may be thinking about using it, and mentor them in the negative side effects that this drug can cause. So if we vote to raise the punishment for the drug and we mentor friends and family about it, then I'm pretty sure that we would deter everyone from using it. Most people, if not all people, even to use it even just once. So if we succeed in deterring them, as I think we would, then we don't have to worry about our loved ones getting one or more of these health-damaging side effects. We also don't have to hear about professional athletes using this drug. And that's very important, because if athletes don't use it, professional athletes don't use drugs, and we don't have to hear about it, then this will start a ripple effect that will stop kids from even trying to use steroids. Because I don't know about you guys, but for myself and a lot of my friends, we all looked up to professional athletes or even like astronauts, and we use them all as role models as when we were growing up. And with them being role models to us, seeing that they don't need anabolic steroids to succeed, I'm sure that we or our younger generation nowadays would think to themselves that if they didn't need it to be successful, then we don't need anabolic steroids either to be successful. Instead of thinking to themselves, well, that guy or that girl used anabolic steroids and now they're professional athletes, so maybe if I use anabolic steroids, I'll become a professional athlete one day. That's not what we want. So that's why it's important that we deter everyone, even professional athletes or famous people, from using anabolic steroids. Clearly, there's a problem with using anabolic steroids. So we need to raise penalties and mentor our kids on not using them. That way we don't have to worry about their health or the health of any other loved one.